I'm the medical director of the Mills Peninsula Diabetes Research Institute. We're conducting clinical trials of new devices and new drugs to help people with diabetes. Diabetes is a condition where there's too much sugar in the bloodstream. It's caused by an absolute deficiency of insulin, or a person having insulin but the insulin not working properly. All the food that we eat is converted in different parts of the body to glucose. And that's the fuel that the cells of our bodies burn for energy. Insulin allows the glucose to be transferred from the bloodstream into the cells that need to burn insulin. Almost every cell will not take up glucose unless there's insulin around. If a person is not making insulin, then they can't utilize the glucose that's in their body. So even though a person may be eating, they can't use the glucose. And so a person ends up burning whatever energy that's stored to live off of. People burn muscle and use the amino acids. People burn fat and use the fatty acids. People certainly don't store any glucose. Everything gets melted away, and people who don't have insulin literally melt away and eventually will die. But with insulin, then the glucose can be transferred into the cells and the person can function just fine. There are two main types of diabetes. Type 1 diabetes usually begins in childhood. These people have no insulin. They're children at the onset. They're thin. If they don't receive insulin shots, they'll die. This is a disease of a total deficiency of insulin. Then there's type 2 diabetes, which traditionally begins in middle age, although recently it's been starting in younger and younger people, even teenagers. But these people are usually middle-aged, they're overweight, they have insulin, but they don't have enough insulin. First thing a person with diabetes notices is that they're peeing more than usual. Having all that sugar leave the body with water means a person gets dehydrated. So the next thing they notice is they're thirstier than usual. So a classic symptom is peeing a lot, drinking a lot. As a person loses sugar, they're also melting away the protein and fat. What they typically notice is weight loss. And many of these people are actually hungry because their body cells are starving. The body can't use the sugar. Then, because the person is losing weight and they're starving, they're almost always tired. A lot of times there's sugar that's in different parts of the body, including in the skin and the sweat, other places, and people can get certain kinds of infections from fungus that lives on diabetes, skin infections. Later on, if a person has chronically high blood sugar and they know they have diabetes, they've had it for many years, all that sugar in the bloodstream can then start to cause damage to some of the vital organs, and then there's additional symptoms. And the organs that are most specifically affected are the eyes, the kidneys, and the nerves. Just about every part of the body eventually will be damaged by high blood sugar. It's not right, it's not natural, and it should be treated. When I first went into endocrinology, I was interested in diabetes as an interesting academic, intellectual exercise to apply biochemistry. There weren't that many people who needed diabetes experts at the time. Type 1 diabetes was around. It was fairly rare. Type 2 diabetes, which we associate with obesity and a lack of exercise, was actually pretty rare in the 70s and 80s. But what's really changed is the dramatic increase in obesity and type 2 diabetes. Type 2 diabetes is no longer rare, it's actually very common. There's probably about 20 or 22 million Americans with type 2 diabetes, and there were just a few million back when I first went into endocrinology. And the numbers of type 2 diabetes patients are just increasing tremendously. Type 2 diabetes is usually caused by obesity and lack of exercise and a genetic susceptibility, and when you put all that together, the net result is resistance to insulin. I mentioned earlier that people with diabetes have no insulin, or they have a resistance to insulin, and if the insulin doesn't work, that's about as bad as if you don't have insulin. And when people get overweight, many of them develop resistance to insulin. So we're seeing a society in which obesity is just becoming rampant and type 2 diabetes is becoming rampant. Here's an example. At UCSF has a pediatric diabetes clinic, and of course children with type 1 diabetes who are thin, give themselves insulin injections, go there for treatments. When I was training, there was no such thing as an obese child who was so obese that they would have type 2 diabetes. That just didn't exist. It exists now. In fact, half the patients at UCSF Diabetes Pediatric Clinic have type 2 diabetes because there are so many obese kids. So the earliest age of diabetes, we used to say it would start in the 50s typically. Well, it's moved on down into the late teenage years. For the first time in the history of the United States, the lifespan of children who are born now is shorter than it used to be. Up until now, every year people live a little longer. Now it's getting shorter, and that's because obesity. It's expected that a high percentage of the children who are born now will become obese, and the complication of obesity will shorten their lives. Well, I think if people don't want to get diabetes, the best thing a person can do is start an exercise program. If people want to live a long time, the best thing is have healthy lifestyle. 3 things especially: exercise, eat healthy, and don't smoke. People who do those 3 things will live 15 years longer than people who do. Among seniors, about 20% or more have type 2 diabetes. Maybe half of those know they have it and half of those don't know they have it. It's important for a person with diabetes to know they have it and then to start on treatment. Diabetes is a very big risk factor for some terrible problems. It's the biggest risk factor for blindness, for kidney failure, for amputations. And many of the people who suffer from those problems, the problem could have been averted if it had been known, if they'd received proper care. Diabetes will triple the incidence of risk of heart attack and stroke. And an interesting statistic that just keeps coming up over and over again: we know that if somebody's had a heart attack, the risk of a second heart attack is much higher than somebody who's never had a heart attack in the first place. Well, it turns out that if a person has diabetes, their risk of a first heart attack is the same as the risk of a first heart attack patient having a second heart attack. So that's pretty high risk. Many patients don't go to see a diabetes specialist. I see a lot of patients who have been going to a general doctor, and their care may not have been up to date. It may be 20 years behind or more, and these people are developing complications of high blood sugar, and they say, well, my doctor told me he knows how, or she knows how to take care of diabetes. I don't need to see a specialist. Diabetes is changing quite a bit. Almost every drug that I use for diabetes didn't even exist 10 years ago. So if a doctor completed their internship and residency more than 10 years ago, which means maybe they're 40 years old or over, there's a good chance that they didn't get direct training in these products. They had to learn about them after they were in practice, and maybe they did, maybe they didn't. But if a person has a question, they could see an expert.